Imagine this. Your mom has been struggling to manage her medications. Your dad can't safely drive anymore, and you've been juggling work, your kids, and their endless doctor appointments. Every week feels like a crisis, and the system feels impossible to navigate. Now, imagine if there were a single program that coordinated everything: medical care, adult day programs, transportation, prescriptions, home support, and even social activities all under one roof. That's what PACE was designed to do. And right here in the Bay Area, On Lok is the pioneer that brought it all to life. Hi, I'm Dale Corpus, a senior transition specialist and seniors real estate expert based in the San Francisco Bay Area. As part of the sandwich generation myself, I know how overwhelming it is to juggle raising kids while caring for aging parents. I created this podcast, Simplify Senior Transitions, to make these conversations easier. I promise to you, every episode brings real stories, practical tools, and expert insights to help families move forward with confidence instead of stress. And today I'm joined by Nicole Torres, the Chief Operating Officer of On Lok, one of California's most respected senior care organizations and a national leader in the program of all-inclusive care for the elderly, also known as PACE. In this episode, we'll unpack what PACE actually is and who qualifies, how On Lok's model supports aging in place for Bay Area seniors, the difference between PACE and Medi-Cal's CBAS program, how families can enroll or refer loved ones into the program, and how integrated care like this is reshaping the future of senior living. If you've ever wondered how your loved one can stay independent while getting the right level of medical and social support, this episode is for you. Let's dive in.
Welcome to the Simplify Senior Transitions podcast, where we help families navigate senior living, real estate, and everything in between. Hosted by senior transition specialist Dale Corpus, this show brings you expert insights, real solutions, and stress-free strategies to make senior transitions simple. Ready to dive in? Let's go.
And we're back, everybody. Nicole, welcome to the show today. How are you?
I'm doing well, Dale. Thanks so much for giving me the opportunity today.
I've been wanting to have somebody talk about PACE for such a long time, so I'm glad that we're doing this today. So let's start with this. Let's start with your journey. What led you into senior care and ultimately to your leadership role at On Lok?
Well, this is perfect timing, Dale. In April of this year, it's going to hit 24 years that I've been an employee, a community member of On Lok. And interestingly enough, what brought me to On Lok was my grandmother.
Okay.
In Tagalog, we call that Lola. She was diagnosed with cancer. She was in her terminal stage of cancer.
Yeah.
And at the time, I was about a couple of years into my nursing profession, working at Lucille Packard, but on the other spectrum of care, it was with pediatric. And she raised me, obviously, with the support of my family. And it was time for me to give back. And so I was looking for some opportunities back in San Francisco, and I landed upon On Lok. And although it had been there already for so many years, it was a foreign concept to me. And so it was through her care and then unfortunately her dying journey that it actually brought me to On Lok. I thought it was going to be just a temporary opportunity while I was caring for my grandmother, and it's going to hit 24 years and I've never looked back ever since.
Wow, time flew. So check this out. I first heard about PACE around this time last year. So it's 2026 right now. So I heard about it in the beginning of 2025, and it's a great model. And I know a lot of people are unfamiliar with it. So can you just give us a quick overview of On Lok's history and how it pioneered the PACE model?
Yeah. That question, first your question and then your response about just having heard about it recently is all the more reason why this is probably the most important question for our conversation today. So let me first start off with On Lok. So On Lok is Cantonese for peaceful, happy abode or peaceful home. And the organization itself, we're a nonprofit organization, community-based care, focusing on care and services for older adults. So that's older adults across the continuum. Like, we all age differently.
Right.
So there's well seniors, there's seniors at risk, and then there's seniors who are frail. And so in September of this year, we'll be hitting our 55-year anniversary as an organization. How did we start? we started because there was one simple question that needed to be asked. A simple question, but really a complexity of responses. And so that was to serve the older adult in the community. It was built out of the immigrant struggle of older adults as well as the locals of the San Francisco Bay Area community. They needed an alternative to being institutionalized. What does that mean? Having to be put in a nursing home or a setting outside of their own home where probably most people like to age. And so through that question of how do we help an older adult, the program grew and it became the alternative for older adults having to be institutionalized.
Okay. And was first originated in the city of San Francisco. Is that correct?
Correct.
Yeah.
Correct. Right in the heart of the Chinatown and North Beach neighborhoods of the city.
And so what is your role as COO at On Lok entail, and what do you love most about what you do?
So, because as you referenced earlier, we are the founders of the model of care, which is PACE, Program of All-Inclusive Care for the Elderly. That essentially is what drew me to On Lok and why I continue to be at On Lok. It's a program that allows you to care for the older adult by understanding not just their medical needs, but their social needs as well as their functional needs and sort of how they get through a day to day. And that really encompasses first my formal education as a registered nurse, and then my ongoing beliefs about caring about an older adult and caring about a human requires that you understand holistically all dimensions of their life. That really allowed me from the time I started, which was as a home care nurse, and navigating through different opportunities of, different positions within the org. I've been the COO now, which is a chief operating officer for On Lok, a little bit over 3 years. That's just a fancy formality for one of the leaders within the org who ensures that the service that you provide with your customers, in this case, our older adults, there's nothing in between that flow of service to care that's in the way for the older adult. So that means I support the workforce, I stay connected to the caregivers, and then everything in between within the organization, I have to make sure is running smoothly, whether it's adequate staffing, whether it's quality of care, adequate technology, supplies, etc. That is a key position to ensure that the entire organization is like really running smoothly to serve who we're intending to serve.
Okay. If you bumped into somebody and they asked what is PACE about, how do you describe the program to families just hearing about it for the very first time?
It's something that I've learned to describe over the years. So instead of simply saying the scripted, we are a comprehensive integrated health plan and a community, I don't do that anymore.
Yeah.
So when I'm asked the question, I ask them now, how do you think about your health care and how you receive your health care? Tell me a little bit more about how you get your health care now. And so typically people answer me, well, I have a doctor. If I'm sick, I see the doctor. If I have medications, then I go to the local, pharmacy. If I'm sick, I might need to go into urgent care or I might need to eventually go in the hospital. So then I follow with, are all of those people like in the same building? Are they with one organization? Typically the answer is no. Different buildings, different organizations, requires a lot of coordination. And all of those individuals might not be talking to each other. So you might get your medication at the wrong time. The doctor said you could pick it up at this. So I use their own experience to then describe, well, On Lok and On Lok PACE is opposite of that. We have all of those services for care and your health under one organization and under one team who's coordinating that on your behalf.
I get that. Now, a related question, again, I know you covered a little bit of this. What makes PACE model different from home care services or just, again, traditional healthcare?
Traditional healthcare, as we know it, is typically siloed in that there are different organizations, different companies, different providers that work separate and apart. And then somehow the consumer of the care of the health, in this case, you or I, it is up to us to configure out how to coordinate that. Over the years, right, that has been improved, but there's still much to do. How is that different for On Lok PACE? As I mentioned before, within the PACE program, all of those different providers and services are under one organization. So in the case of PACE, the way we're structured, we're a health plan, we're the provider of care, we employ the core disciplines and services that provide you your care. And then we also contract with all of the different providers within the local neighborhoods to serve you. So the difference is we're not a separate health plan. We're not a separate provider of care. That is all under one roof, and it's coordinated dependent upon what the individual senior's needs are.
Okay. Can you walk us through a typical day for a PACE participant? What does their care experience actually look like?
So a typical PACE participant has various needs. So they can have medical needs, social needs, functional needs, and a little bit of all of the above. So typical day is wake up, and you normally need to think about, what do I need to eat? How do I need to dress? What kind of meds do I need? So in the case of an average older adult like that, you might have a home care caregiver that rings the doorbell, comes into the house, greets you, and assists you with all those things, because perhaps functionally you're not able to do that on your own, or you need some help with your medication reminder. So that home care caregiver might remind you to take your medications, help pull out your clothes from the closet, help you prepare your meals, and given the types of needs you may have, you might attend our PACE center.
Yeah.
And so that home care caregiver will come essentially in the morning to help get you ready for the day. And then it's not always easy to get from your home to wherever you need to be. We also provide transportation door to door. So the caregiver will make sure you're ready, and ready at the time that your On Lok PACE driver needs to pick you up. And let's say you have 16 steps to go down and you need some help. Not only will the caregiver, but the driver will go up the stairs into your house, in your kitchen, to assist you to come down safely, and then have you go into one of our On Lok fleet vehicles. And then, within 15, 20 minutes, depending on where you are, you're going to go into the center, be greeted by the staff. At that point, you might need to go into the clinic, because we also have a clinic. So in addition to the adult day healthcare space, there's also a clinic and there's also a gym. So let's say for this average senior, they have an appointment to see their doctor, who is an MD, but it's not until 10, but you get there at 9. So you go into the adult day health center first. You're greeted by the caregivers there. You're greeted by the activity staff. At that point, you're engaging in breakfast. You're enjoying activities. And soon enough, your aide from the clinic will actually come and get you and bring you down to be seen in the clinic. And there you get a sort of an example of, you might get support from the clinic. You might get support from your social worker. You'll come back up for lunch. And eventually the driver, that same driver, most often will be the one picking you up to take you back to your home. But what makes it actually really special, let's say you don't have anyone to help you with meals. So before you actually leave the center, you are provided your portable meal for you to then eat for dinner. Yeah. And then that same caregiver or your caregiver's partner is actually going to meet you by the time you arrive to then help you with your evening care, warm up your meals, and then some of your medication.
Wow. You guys do a lot. It is very comprehensive. How is this even funded, and what's the cost for this type of program?
So PACE is funded by Medicare or Medicaid. So in the case of Medicaid for California, we refer to that as Medi-Cal. So depending on your health coverage, be it Medicare, Medi-Cal, a combination of both, there's a rare few that have, private pay. They're either Medi-Cal only or Medicare only. You might have some level of a monthly premium, but typically there are no copays or no deductibles at all.
Okay.
Fascinating stuff, I know.
No, what are some of the biggest misconceptions families have about PACE?
That people don't even know what it is. At first, they don't even know what it is, because how could you? If we are only taught and know, even in our own individual experiences, to receive care in the traditional healthcare sense, people don't even know what the word like integrated means. That's why I never like starting off with the model of care is integrated, because they don't even know what the difference is. So the misconception is, one, they don't even know it exists. Two, you can't describe it by simply saying it's integrated care. You have to ask them, how do you receive your care now? And then work your way through that to show them that there's an option that things could be done holistically. And then the other thing is that people often think that it's a limiting choice. What in fact is broadening access to the right type of care that's matched against the needs that you have.
Okay, that makes sense. So, how does the program then coordinate
Okay.
across doctors, specialists, transportation, and family caregivers?
So the secret sauce to the model care is the interdisciplinary team.
Okay.
There's actual 11 members on the team that's comprised of your doctor, a nurse, a social worker, a physical therapist, an occupational therapist, transportation, your caregivers. They're all under one team, and that team is all assigned to you, and
Yeah.
they coordinate your care on your behalf, not only within the structure of the PACE model, but also with all of the extended network of specialists, of nursing homes,
Yeah.
of hospitals. That's all coordinated within the context of the interdisciplinary team.
Big important question. Let's talk about eligibility. Who is eligible to enroll,
Sure.
and what's the process like for applying or being assessed?
So to be eligible is 55 years or older,
Hmm.
live within the service area of the PACE program. So what does that exactly mean? So it's a bunch of zip codes that the PACE program is permits to provide care to. So if you live in any one of those zip codes, you're more than likely, that's check one of what you'll be eligible for. And the other is that you have different care needs that stem from either your medical conditions, your functional condition, or social, and a combination of all that warrant that you need support
Yeah.
other than what you're doing now, and to be able to still do that and thrive, but do it within the context of your community and your home setting.
Okay. From your experience, what's the emotional impact on families once their loved one joins PACE?
This is like near and dear because I'm actually living it too as a sandwich generation person. I would say the first thing is like relief, like a breath, like,
Yeah. Yeah.
wow, there are people out there other than myself and my family that could help me do this. That's the first immediate response. And then the other would be like, oh, this is achievable. I could still live my life and still figure out how to support my loved one, whether it's a grandmother, whether it's your own parent or, a dear family friend. They know that they can do this, and it's hard, but not do it alone.
You guys take away a lot of this overwhelm that a lot of the sandwich generation, older adults, have. And I love that. Now, can you share a story that really captures how this program changes lives?
Oh yeah, I have 24 years worth of stories. And one that resonates with me is, so as part of my work as a leader of the organization, if I am now out there learning and understanding the story of the people that we're serving, that's one. And then the other half, which is the workforce who's providing the care, I don't feel credible to be in the role that I'm at. So what that means is I go out into the community and I stay connected with our seniors as well as our staff. So about a couple of years ago, I was visiting a family for a home visit. I believe it was in Fremont. And it was when we knew there was a home care caregiver visits occurring. And I went in the home, and there happened to be a mid-age couple, I'd call them. They were in the sandwich generation. Their parent had recently joined the program, both of their parents, their mom and dad. And you could just imagine this. I walk into the home and it's a multi-generational family.
Mhm.
The grandparents, the mom and dad, and then 3 little kids. And so they were struck by my visit and they said, I heard that you're the chief operating officer. Why are you coming here? And I told them the same thing I told you. Like, it's my responsibility to understand what the experience is. And so we kind of got over that. Like, why would she be coming here? And I said, no, it's simply just to see how you all are doing. And what they shared with me was that they were super grateful for this model of care, which they know didn't even exist because of a couple of things. One, they're in the sandwich generation. 2, both of their parents both need care at the same time. 3, they still both have jobs and they're still raising their kids.
Mm-hmm.
So they told me that we provided them great relief because it allowed the husband in his hybrid schedule to be able to go to work sometimes. It allowed the wife, who's actually running a daycare
Yeah.
on the lot,
Yeah.
to do some of her own professional aspiration. And then when both of their parents were either at our center for their needs, or there were home care caregivers providing care, it allowed relief knowing that there were people still taking care of both of their parents adequately. And they had no clue that there was a model like there that existed. And then, interesting enough, the daughter, who is the daughter-in-law, she pulled me aside and whispered, "Oh, and it's helping our marriage."
Wow.
And so just on so many levels, I saw how that was all working. And then indirectly, this is where I think the beauty of like intergenerational care is important. The young children were seeing how their parents were still making it work to take care of them and to take care of their parents in a respectful way. And then how the little kids could be a part of that, which could essentially role model for them, what's possible when it's their time to be in the sandwich generation.
Yeah. I love that story. Thank you for sharing that. Now, how does PACE help prevent hospitalizations from nursing home placement?
That's a great question, because not just On Lok PACE, but PACE organizations across the United States, because there's now like, I think around 200
Hmm.
PACE organizations across the United States. What we all are proud about in terms of model of care is that we prevent premature nursing home placement. And then our numbers are reduced in terms of how many are actually institutionalized. And then two, we reduce hospitalization. And then we also reduce the need for them to be readmitted into the hospital. How do we do that? It goes back to that interdisciplinary team.
Hmm.
You got 11 disciplines, eyes, ears, which is inclusive of the driver and inclusive of the caregiver, thinking from a preventative perspective and doing anything to reduce risk and also exacerbate or make worse any of the health conditions that the older adult has.
Yeah. What kind of support do family caregivers get through On Lok's model?
First, again, building on that sense of relief and breath of fresh air, we become the extension of the care network for the older adult. And so one of the things that is important is the impact of this model of care, because it is truly integrated. It's like compounding. It helps the support system around the older adult, and it helps the support system of the support system, and essentially like helping the broader community. So for the family, it gives them education, it gives them respite, and it gives them alternatives to getting the care that their older adult needs without the burden and the pressure of coordinating. It allows them to actually like sleep at night,
Yeah.
knowing that their older adult is safe and actually getting quality care.
How does PACE balance medical needs with social engagement and quality of life?
I would say that instead of the word balance, it integrates all of those things. Okay. And that's holistic. That's holistic care. How does that actually play out? The care team itself, we meet nearly every day in some capacity, whether it's a formal meeting or in the hallway or in the clinic. We can't singularly like talk about the participants, because we refer to the older adult as participants because they're participating in their care. You can't singularly just talk about the medical conditions, the social conditions, the functional conditions. Every conversation about the care of the older adult requires like a full picture. So when any decision has to be made, like what kind of meds they need, what type of food they should be eating, what type of clinical care they should be getting, whether it's from the physical therapist or the nurse, you have to think about the whole person in order to come up with the right care plan. And so it's more about integration and well beyond balance.
I want to segue now to how the PACE compares to other programs like CVAS. A lot of people confuse
Yeah.
PACE with Medi-Cal's CVAS, also known as the Community-Based Adult Services. Can you clarify how they differ?
Yeah. So let's start simply. So CBAS, which is often called community-based adult services, that's more of a service benefit. And then PACE, it's a full health plan as well as a care system. Okay. So the difference is CBAS is an adult day health program. So much of the services for the older adult is received within the context of their center. And then they still receive their medical services from their own medical provider. which is opposite of the PACE program. The PACE program is that adult day healthcare model plus primary care. And then we employ the medical professionals under one organization.
A follow-up question, like for seniors currently enrolled in CBAS, when might it make sense to transition to PACE?
Sometimes that's not an easy question when you're the actual senior, right? To know, like, do I need more care or the family caregiver? So what I could say, I think simply put is, if your medical care starts to become complex and the issues around your medical care and your functional care and your social care are all requiring more work and coordination, PACE might be the option for you. And if you're not sure, the simplest thing is, call to find out. And that's usually when we go through a full assessment process to determine where and who would meet your care the best.
Yeah, I understand now. What are the biggest advantages of PACE for families who want to keep their loved one at home?
So they want to keep their family at home, their loved one at home. That's one of the key missions of the model of care. It is to keep the older adult from being institutionalized and allow them to get their care at home. And so that desire of the family is aligned with the actual mission, first and foremost. And then in doing so, because of the way that the model of care design, as I mentioned before, that really allows all the other things that typically happen, increase hospitalization, increase ER stays. We do the opposite of that. We reduce those types of needs to happen because of that model of care.
On Lok serve diverse communities across San Francisco, Santa Clara, and parts of Alameda County even, such as Fremont and Newark. How do you tailor care to meet those varied needs across counties with different economic, cultural, and healthcare landscapes?
Oh, yeah. That's that 55-year journey, and it's still going. So you mentioned the different counties we serve. We serve all of San Francisco County, all of Santa Clara County, and within Alameda, it's Fremont, Newark, and Union City. So you could imagine, Bay Area, what are we known for? We're known for being diverse. So one of the things is that care as diverse as a Bay. That's what we pride ourselves on. So all the possible ethnic groups, linguistic groups within the Bay Area, we serve. And how do we do it? Because we're serving in the community and we're serving it with people that are from the community.
Yeah.
In addition to that, we also, over the last 3 years or so, we were the first organization at the national level to open our first adult day program for LGBTQ plus seniors in San Francisco with our partners Open House.
Yeah. What partnerships has On Lok built with local hospitals, nonprofits, or senior centers to reach more families?
So that was one example with Open House a little bit over 3 years ago. We recognized that there was a need for LGBTQ plus seniors to receive their care. So we had a partnership there. And because of the community-based organization that we are, we pretty much contract and partner with all hospitals and community-based organizations within the different regions that we serve. And so in that large net, most of the providers external to us, hospitals, community-based organizations, specialty groups like skin doctors, heart doctors, bone doctors, they all are aware of On Lok and On Lok PACE as an option. And they will usually be able to, for the most part, identify the potential need that they might benefit from the program, and that they will refer families as well as the senior to us.
Yeah. How do you ensure equity and accessibility, especially for non-English speaking families?
We pride ourselves of being multilingual and then multicultural. So many of our seniors are monolingual or are from countries other than America. And so we are built on that story. And so it is embedded in our work. It's embedded in the bilingual staff. It's embedded in the programming. And then it's also embedded in any of the written, communication that we provide to our participants in all of the native language. In fact, it's built into the regulation that you actually ensure that there is equity and accessibility in all of our services.
Are there plans to expand PACE centers or services into even more Bay Area cities?
Oh, for sure. So right now we have 7 physical PACE centers across the Bay Area. And then I'm happy to share that mid-February, we'll be opening 2 more
Yeah.
locations. Yeah. One is in South San Jose. We already have 2 in the Santa Clara area, so we'll have 3 now. And then the other is in Union City. So about mid-February, we'll be celebrating those openings and with open doors, welcoming all of the community to really celebrate in a big accomplishment for the organization, but more importantly, for the growth of PACE across the nation.
That's a lot. You guys must use technology. How is On Lok using technology to improve the seniors' care experience, whether that's telehealth, remote monitoring, or digital engagement?
Technology really tested a model like this during COVID, because regardless of the wealth of technology available to us, especially in the Bay Area, some care is still high touch, meaning it requires you to have a physical person there to support the older adult. So in the case of technology, we are constantly being engaged to try something because of our, sort of foundering and pioneering reputation. And I would say that right now we've been investing in technology that makes this integration of care seamless. So we have electronic health records, we have different platforms that allow the communication of information between all of the services within and outside to be communicated seamlessly in an automated way. And then, of course, we've dabbled in a few things. There's a lot of organizations who are trying to look for alternatives, let's say for companionship for older adults, and they're creating these avatars, live avatars that display on a screen and allow for companionship for the older adult. So we've piloted some of those things, looking at robotics to help if there's like mobility issues for the older adult in the home, and helping the robot with like fetch their meal or remind them to take meds. Those are all things that we've been piloting. And then certainly, how could we not? We've invested in AI to not just support the older adult, the senior, but also to support the staff in allowing them to automate some of the work so we could stick to high touch care.
Yeah. And what role do you see PACE playing in the future of aging in place in California?
We will and are continuing to be the voice of aging, the voice of the older adult. And so while On Lok and On Lok PACE is well known for serving the frail, the older adult at the end of the continuum, strategically, our focus is honoring that there is a continuum of aging. So you have well seniors, you have at-risk seniors and frail seniors. And I know much of our questions have been around our PACE program and serving the frail seniors, but we also have a multitude of services that serve seniors for those that when they're still well and they're at risk. So we like to be at the table, given that we created the PACE model around advocacy, policy, and then at government and county level. So in addition to the direct care that we provide, a lot of our leadership, we are very engaged in those policy conversations and advocacy conversations. And in fact, because I've mentioned that, there's over like 200 PACE organizations within the United States now, California is the fastest growing state in our PACE program. So we're here to be ahead of that and to ensure that there continues to be more access. And I think even before that, even more awareness, because people still don't even know what it is. And if they do, you really don't know until you actually visit and see what it's like for yourself.
What inspires you personally about the work being done at On Lok and across the PACE network nationally?
When I go into the centers, the clinic, or the home, or hop in an On Lok fleet with a participant and I see them like smiling, moving, like engaging in life, and then knowing that our model of care is allowing the over 2,000 people that we serve in the Bay Area to do that. But then nationally, to your point, we're just under like 90,000 serving across all the PACE organizations. But that also tells you there's still more opportunity to do that. So that's what really inspires me, that there is so many more older adults that we can serve so that they actually have quality and dignity in their later years of life.
Yeah. And for families listening who are overwhelmed and don't know where to start, what's the first step you recommend that they take?
Yeah. You had asked earlier a little bit about, the intake process, which I didn't have the chance to describe. And so one of the things is first to the family member, like take a deep breath, know that you're not alone. We could potentially be an option. You won't know until you either give us a call or visit our center. And when you do that, you can get a tour. It can be something that's no pressure, just see and feel how it's like. And then when you feel most comfortable of what you're struggling with to care for your older adult, just let us know. If you're having a hard time with getting them to remember to take their meds, or you're concerned that they're falling at night, or you're starting to notice that they're a little bit more forgetful, we could possibly be a solution. And it just starts with the question, and it's at no cost to the family or to the older adult to just even begin the assessment process, because that starts with someone asking you questions about how we could help you. And then eventually you would meet doctors, nurses, social workers, therapists, dietitians who will ask you some key questions to know if we are the option of care for their loved one.
Now, a good amount of my podcast audience are healthcare professionals and senior care providers. How can they refer families to On Lok?
So there's different modes of connecting. So through the website, it's onlok.org. We have a main line that I'm, happy to share when the time is right. But what I do encourage are open doors. So visit one of our 7 locations. And any one of us, including myself, are happy to tour you around the space. Because a lot of your viewers are healthcare professionals, we are more than happy to go out to your organization, whether it's a hospital, whether it's a community-based organization, and do any sort of outreach, in-service events. We do it all the time because there are, turnover naturally in many organization hospital settings. It's already embedded to what we do. We always provide informational presentations to any health-based organizations or community-based organizations to learn about what we do so they know if we become a referral option for them down the line for any one of their clients, their members that they recognize there's a need for.
Okay. In closing, as we wrap up this episode, do you have any final words and just any other contact information that you want to give out?
Yeah. I'll give the contact information and then I'll share my final words. So contact information, we do have a main line, and just to be sure, it's 1-855-973-1110. Okay. And then onlok.org. So onlok.org. And then from there, you'll be able to learn more about the PACE program and learn how to especially make a visit, which I highly encourage for you all. Last words. Yeah. Aging can be hard, but it's beautiful. And so aging shouldn't be alone. And if you are in a situation where you're taking care of an older adult, you don't have to do it alone. On Lok can be an option. On Lok Pace could be an option. Any of our services could be an option. But it usually starts with reaching out and just asking the question.
Perfect. Nicole, thank you so much for joining me today and sharing your expertise and heart with our listeners. The work you and your team are doing at On Lok is transforming how seniors experience care, not just here in the Bay Area, but nationwide. And for those of you watching or listening, if your loved one is considering senior living and you're not sure how to fund their care, let's talk. Schedule a free consultation and learn more about my services at www.simplifyseniortransitions.com. Have a quick question, DM me on Instagram at SoldByDale. And don't forget, check out the past episodes of the Simplify Senior Transitions podcast right here on YouTube, or stream it on Spotify, Apple Podcasts, and more. If you found this interview helpful, please leave a 5-star review. It helps more families discover the show and access the support they need. Thanks for tuning in, and I'll see you all on the next episode of the Simplify Senior Transitions podcast.